Meet Cape May County Freeholder Kristine Gabor, plus find out what Cape May County is doing to control the mosquito population. That's all next on the Cape May County Report. Welcome to the Cape May County Report. I'm Lenora Bonafonte, and joining me now is Cape May County Freeholder Kristine Gabor. Thank you for joining me, Freeholder.
It's a pleasure to be here.
Freeholder, you've been in office now for 6 months, and prior to that, you served on Upper Township Committee for 2 years as a committee woman. So far, tell us what you've learned about being in county government and how it differs from municipal government.
Well, municipal government is, you're dealing with a smaller town, you're more hands-on, I think, with the people and dealing with different issues such as, trash collection and lining fields for soccer and different things of that nature. The county level, you're representing 16 municipalities throughout the county, and everybody has a different set of circumstances. Some are similar, some are very different, and it's important to understand the differences between all the towns so you can properly represent them.
And when you came on this year as a new freeholder, you also came on with Freeholder Will Morey, who has never served in public office before. This was his first time also as a freeholder. And the two of you together took it upon yourself to go out to all of the 16 municipalities, to the Chamber of Commerce and all the different business entities in the county and reach out to them and say, what do you want from county government? Tell us what you learned by doing that and how it's helping you to govern.
Well, it's very important because, like I said, being from one particular town, Upper Township, our needs could be very different from the needs of, say, North Wildwood. So we wanted to learn what the issues and concerns were from each municipality. We also wanted to reach out to them to introduce ourselves so we can have a face-to-face conversation about who we are and what we're there to do. And that is that we're there to assist them with whatever that we can do to make their municipality move forward.
Now, it's a new board, Freeholder Director Gerald Thornton, Freeholder Shepard, yourself, Freeholder Morey, and Freeholder Desideria. Together as a group, what are you working to accomplish this year?
Well, I think what we're trying to do is to work towards keeping the budget where it needs to be so we can operate efficiently. We're looking at all of our departments to see what we can do differently to make things better for everyone, to save the county tax dollar, and to really reach out to everyone and make them understand that the County Freeholder Board is there for them when they need us.
Now, as freeholder, each freeholder oversees certain departments, and as freeholder, you have health and human services. And probably in these tough economic times, they are probably the most difficult departments to handle because there are so many people in need. Tell us a little bit about those departments and why they're important to serve the people of Cape May County.
They're very important because there are a lot of people here that are unemployed. Unemployment rate is quite high, and when people are unemployed and they're down and out, they need assistance with housing, they need assistance with food. You also find that people have a tendency to have more issues with depression, addiction. So not only do we want to make sure that they know what services are available if they need housing assistance or assistance with food stamps, we also want to make sure that they know that there are places they can go if they're having issues with dealing with suicide prevention and addiction services.
And the county provides all of those different services, and many of those departments are under your realm. And the Department of Aging and Disability Services is one of the departments that you oversee. And Cape May County has a large and continuing to grow senior population. We tie with Ocean City for the largest percentage of seniors. It's very hard. They have difficult problems. How is the Department of Aging there to serve them?
Well, our aging population, as you said, is quite high. It's about 23% of our population is over the age of 65. And with the economic downturn, you're finding seniors, their Social Security check doesn't go as far as it used to. A lot of them are on fixed incomes. They're not able to stay in their homes anymore. They can't afford to pay their taxes. They're even having trouble being able to buy food. So the Aging and Disability Services provide things like Meals on Wheels. They also provide services to assist them with anything that they're struggling with. And a lot of seniors, they don't have family nearby. They may have retired here and their children are in another state and they're alone and they don't know where to turn, and we want to make sure that they know that there's assistance for them to help them.
So some place to start if they don't know where to go, if they need something, to start with the Cape May County Department of Aging and Disability Services, and if they can't help you, they'll find a place for you.
Absolutely. We have a great connection of resources for nonprofit organizations organizations in the county, which, you know, without them, you know, I don't know where we would be. We have a wonderful community of volunteers and nonprofit organizations that work diligently to help people in need, you know, such as Volunteers in Medicine, who provide medical care for those who don't have the insurance, and also Cape Assist for addiction services. So, and they're just to name a few. There's many people here that go out of their way to help the people in need here, not just the government.
And as you've been involved this year and got more involved learning about the needs of the elderly and working with them and listening to them when they've come to talk to you, you've said to the public that you would be their advocate if they need help, if they need assistance, that you would be their voice. Why is that important?
Well, I represent aging and disabilities. It's a very important department, and I think that I have an obligation to the aging community to say that I would advocate for them. Like I said, a lot of them are alone. They have nowhere to turn, no family, and sometimes they feel that they're pushed aside, and I think that's everywhere. It's not just here, and we have an obligation to give them what they need so they can live a comfortable life for their remaining years. I mean, they survived depression, recession, you know, wars, economic downturns, and now they need help, and we need to make sure that they know that we're here to help them when they need it.
And statistics show that they're healthier and more money is saved too if they're able to maintain themselves in their own homes. If they're not able to, you also oversee Trest-Haven Nursing and Rehabilitation Center, which is the county's nursing home, and it provides wonderful services for those who need them. Tell us a little bit about that department.
Yes, it's a county-run nursing home, which there aren't very many. They're starting to disappear, but I'm very proud of our nursing home and the staff. We have a wonderful staff of employees there, an administrator, director of nursing. They're doing a wonderful job. I like to spend some time there visiting with the residents and the staff, and they really care about the people that are in there. They have a lot of activities for them, and they really make them feel like they're at home, and it's really important for them.
Well, and not just that, but it's important that they still have touch with the community outside, and some of the events allow them to do that. Recently, they hosted a senior prom there, and you attended the prom, but also brought young gentlemen volunteers from Ocean City High School, so it brings the youth into the center, so that's important
yeah,
too.
It's important to them so they can see that other people outside that care. It was a wonderful event, and so many smiles on their faces. They had their hair and nails done, the tuxedos, the gowns, and it was also important to the youth because I wanted to make sure that the youth see what it's like when you're elderly, what it's like when you're nursing home and alone. They need to understand and appreciate life, and I think that was a good lesson for them as well, and they really did enjoy their time there.
You have many of your apartments intertwine. You talked about Meals on Wheels. The Meals on Wheels program operates in part because of fare free transportation, which is also one of your departments. And in a county where we do not see a lot of public transportation out there, how important is it, the service that the county provides?
It's extremely important, especially for the people who need to get to medical appointments and they need to go to the store just to buy food. Fare-free transportation is a very important part of our infrastructure in Cape May County. Mainly because we have, like you said, a lack of public transportation here, and there's a growing need. There are more and more people that need to get places that just can't do it on their own, and we're working diligently to make sure that we provide that service.
Well, in these tough economic times, I know we often get phone calls about people wanting more transportation, and as the county is trying to spread its budget, how hard is it to continue to provide these services?
It is very difficult. It's very trying, but that's all part of looking at every facet of county government and how your tax dollars are spent, and make sure that you're prioritized so you can give the services where they need to go. And that's what we're going to continue to do.
The Cape May County Department of Health also provides services for residents in the county. Clinics for those in need, from early intervention to screenings for seniors. Tell us about the health services and why they're important today.
Yeah, there are many services available to county residents through our health department, and what we're really trying to do now is publicize them as much as we possibly can, because I've been a county resident for 27 years, and a lot of services I didn't even know were available till I came into becoming a freeholder. So we need to make sure that we take care of our residents to keep them healthy. When they're healthy, they're productive, and then our community will thrive.
And the health department does offer a number of programs and clinics that are available. You can find out more about them on their website, cmchealth.net. But throughout the year, there are programs for young and old in Cape May County. one of your other departments, which really ties in with the health, but it's stretched to put it in, but mosquito control is one of your departments, and we're going to take a break. When we come back, we'll find out about mosquito control and what we're doing in Cape May County to keep that population down. So please stay with us.
How far would you go to feel young again? How far to capture the sun? To walk in the wild? To celebrate new traditions? How far would you go to just slow things down? Your journey begins at njsouthernshore.com, New Jersey's Southern Shore region.
How far would you go to build a kingdom? How far to save a species? To shoot the rapids? To bolt at the speed of lightning? How far would you go to live in another century? To share new discoveries? To make the summer last forever? Your journey begins at njsouthernshore.com, New Jersey's Southern Shore region.
Welcome back to the Cape May County Report. I'm Lenora Bonafonte, Cape May County Communications Director, along with Freeholder Kristine Gabor. And joining us now is Dr. Peter Bosak, who's the Superintendent of the Cape May County Department of Mosquito Control. Thank you for joining us, Dr. Bosak.
My pleasure.
Freeholder Gabor, this time of year, we can hardly think of anything else but mosquitoes. And in Cape May County, when tourism is the #1 industry, why is it important, not just for health reasons, but for nuisance reasons, to control the mosquito population?
Well, obviously here in Cape May County, a lot of the tourism has to do with outdoor activities, and we want everyone to be comfortable and enjoy their time here outdoors and be here as much as they possibly can. So we have a need to control the mosquito population from a tourism perspective, but also from a health perspective.
Now, Dr. Bosak, it's a difficult task to do. Tell us what the mission of the Mosquito Commission is and how you go about to control mosquitoes in Cape May County.
Well, the first thing is we're not out to eliminate mosquitoes completely. What we want to do is we want to reduce the populations to livable levels, to levels that people can deal with. And we do that in a variety of different ways, starting with water management to controlling mosquito larvae or juvenile mosquitoes or adult mosquitoes.
Now, you say we don't want to eliminate the population. Do mosquitoes serve a greater purpose also besides being a nuisance?
That's a good question, and I get asked that a lot. And it really is true that mosquitoes are part of the food web or the food chain, depending on what you were taught. But they serve as food for fish, for birds, for spiders, for other insects. So they're an integral part of the food web. And now if they were gone, would it make a huge difference? Probably not, but it wouldn't be a good thing.
So to control the population so that the nuisance factor is not so great in Cape May County, tell us about the integrated process that you use, because many people, when they think about mosquito control, they think about the big truck coming and spraying you, or the helicopter coming and spraying you, but there's more to the process. Tell us what you do.
Yeah, it's what we would call an integrated pest management program, or in this case, we would even refer to it as an integrated mosquito management program. And what that entails is many different ways to control mosquitoes, not just using pesticides. And in fact, pesticides would be our last resort when it comes to controlling mosquitoes. So the one truism about all mosquitoes is that they all start out in water. So that's where we start. If we can control water, then we can control the predominant part of the mosquito population. So we start out with water management, and then when we can't control the water, then we move to the next level, which would be controlling the larvae in the water. And the reason we want to do that is because that's an easier place to actually eliminate the mosquitoes, because they're all together. Once they start flying, then they spread out and move across the whole county. It makes it much more difficult to control them. So that's sort of the stepwise process. So it's water management and controlling the juveniles, the larval stages, and then the adults.
So when you look at the water management, what are some of the things you do?
Yeah, if you drive along the parkway, you'll often see ditches in the salt marshes. Those ditches are very old. They were probably there early part of the 1900s were dug. That was to remove the water from the salt marsh. We've learned different scenarios now to control mosquitoes, and we use a particular management program called OMWAM, which is Open Marsh Water Management. And this involves creating certain types of ditches and creating ponds so that the water collects in those ponds along with fish, and fish then eat the mosquito larvae that normally would be caught in little places along the surface of the salt marsh.
So it's an involved process, and on a personal level for a person, it takes to a greater level when we tell a person to remove the standing water from your property or to get any water that's laying there.
Right. Years ago when we used to tell people that, it was more or less to make people feel good that they're doing something and helping with the process of removing mosquitoes. Because people do generate mosquitoes at their own home, and those mosquitoes will bite them. But before West Nile virus, that was more of a nuisance factor. Now with West Nile virus on the scene since 1999, those mosquitoes that are produced around homes in standing water, in buckets, in your bird bath or something like that, those mosquitoes are actually ones that can transmit West Nile virus. And now the method or the message to remove that water is even more important.
Now, since you brought up West Nile virus, we'll kind of jump to that area. When you look at the health factor of mosquitoes and talked about diseases such as West Nile virus, triple E. There's concern for that. But now that you mention them, for the public to know, how rare are those cases in Cape May County?
Well, actually, in Cape May County, they're relatively rare, and I'd like to think that's because we do a great job. Because I have a fantastic staff that is on top of things, and that part of that is true. Also, though, the environment is slightly different than, say, North Jersey. In northern New Jersey, the West Nile virus rate is much higher. But up there, they don't have eastern equine encephalitis as we do down here. They're both relatively rare in Cape May County, but the point being is that they can show up at any time. And so we have to be vigilant, and we always have to monitor the mosquito populations to pick that up so that we can control them.
Now, are there different mosquito populations that would carry these type of diseases? And I know when I start to say this, I look at Freeholder Gabor, and I know Freeholder Gabor and myself are saying a mosquito is a mosquito, but there really are different mosquitoes.
Yeah, and to the general public, you're right, a mosquito is a mosquito, but in Cape May County we have 45 different species of mosquitoes, and each one of them does something slightly different. They have different life histories, and we have to know every single part of that life history in order to control them. We have to know which ones are important in terms of nuisance, which ones are important in terms of disease transmission. And there are several species, just a handful, that really come up on our radar in terms of disease transmission. And the disease transmission process is complicated, but it involves birds when we're talking about eastern equine encephalitis. Some birds carry it and then they pass it on to mosquitoes. Mosquitoes then bite humans, and it's possible for humans to get infected. So it's an interesting process. It is complex, but it's also relatively easily understood, and we do test for these viruses in our laboratory.
Now, one of the other ways that you go about controlling them is through biological control of mosquitoes. And Freeholder Gabor, you recently visited the Department of Mosquito Control for a special presentation. Tell us about that and what you learned.
Yes, Secretary Fisher from the New Jersey Department of Agriculture was there along with some of his staff to release copepods, which are very small, almost microscopic, but you can see them, crustaceans in the horseshoe crab family that eat the mosquito larva, like the second stage larva. And so what you do is you release these copepods in standing water where the larva exists, and it is a natural way for us to eliminate the mosquito larva before they become flying mosquitoes, and thus, decreases the need for pesticides. So it's a natural way of human nature, of Mother Nature rather, taking care of the mosquito issue.
Now, how, Dr. Bosak, how do you use that process in Cape May County? Is it throughout the county? Is it in different areas? Like, where is that used?
Well, for biological control, each situation is different because, as I mentioned, each mosquito is slightly different. So we have mosquitoes that appear in early spring that then disappear. Then we have species that appear in midsummer that then go away. So we have this whole sort of transitioning of different species. And we have to look at the habitat, we have to look at the species, and then we kind of can customize the kind of control we're looking for. In some situations, biological control is very easy and is appropriate. In other situations, depending on the kind of water or maybe the size of the area, we might have to resort to other means, water management, something like that. So every little situation is different depending on what we're dealing with.
Now, one of the other things that I know the public has heard a lot about in the past few years are mosquito-eating fishes.
Right.
Do you use them in your process?
We do. We have a program where residents can call us if they feel that they have a body of water that may be producing mosquitoes. We would be happy to come out and inspect that body of water and figure out whether or not fish would be a good solution to that problem if in fact mosquito larvae are found. Just because you have standing water doesn't necessarily mean that it's the right habitat for mosquitoes. So we always check that first. We always do an inspection. But we have a free program where people can call, and then if it works out that the fish are appropriate, we will bring them and release them, and it's at no cost to the homeowner.
Now, do you also put them in bodies of water in Cape May County as a whole, or is this just a residential program?
We can do it either way, but there are stipulations. It's a program through the state. The state actually grows the fish in fish farms, and we get them from the state, and then we dispense them as following certain protocol. So the one thing about mosquito fish is that they are very aggressive, and they will have an impact on, let's say, amphibian populations or possibly other fish populations, and we don't want to release them into habitats that might be sensitive. So we really have to be careful of where we release them.
So it's a balance in nature.
It's again a balancing act where we're taking into all accounts the different scenarios that might happen before we release these things into the natural system.
Now, at what point then do pesticides come into play? And when you do look at pesticides, what precautions do you take, and what type of pesticides are used?
Well, we're using several different kinds. In fact, we also use biological pesticides, or what would be considered a biopesticide. An example of that would be what we call BT or BTI, and that's a fancy bacterial name. But what that does is we can introduce that to the water, and the mosquito larvae actually have to eat it or ingest it. And what that does is it destroys their gut system, and it kills them. And it's very specific just to mosquito larvae and just a few other flies. But the beautiful thing about that is it occurs naturally in the environment. It's very specific to mosquitoes, which is really what we're looking for in a control method. And it has very good efficacy or very good control. So there's probably a good 90% plus control using a product like BT. And then we have traditional pesticides, which are all registered through the state of New Jersey, through the federal government, that we might resort to as sort of the last resort. And there are not many different kinds, but the arsenal is getting smaller and smaller, which means we're going to do more biological things. Yeah.
Now, the public often call and they have a lot of questions, and when you talk about pesticides or different things, and the public will want to know, can you come spray my house?
Sure.
Can you come survey my house? Can you check to see if I have mosquitoes?
Right.
What is the answer to that? Do you go to private residents?
Yeah, the typical call is, we have mosquitoes and we can't go outside, and my children are being bit, or it's terrible, and that sort of thing. And as Freeholder Gabor had mentioned, it's about being able to go outside and enjoy the environment.
Correct.
And mosquitoes can stop you from doing that. I know that from my own garden. When I try to garden, I can't because they're so bad. What we do is we take the person's information that calls, we get their address, we do send an inspector out there, and then once the inspector figures out what species of mosquitoes are there, what's biting, because very often we will get people calling for greenhead flies or gnats or something like that.
And when you find something that kills them,
right.
So please let us know.
What we really need to make sure, because our goal is to control mosquitoes, not greenheads or gnats or things like that. And so we have to send someone out to get that information.
So, but the public, they have a lot of questions, they have concerns, and the mosquito department does have a helicopter that does fly by. Tell us about that and why that's important, what part that plays.
Yeah, we are one of the few counties that do have helicopters. Actually, we have relatively old helicopters compared to the other counties, but the helicopters really come into play when we're talking about the salt marsh. And most of our mosquitoes that affect our communities come from the salt marsh. And they can be relentless, as if you're a resident, you know that. So the helicopter has over 100 landing zones in the salt marsh where an inspector is flown out pretty much every day of the week, and areas are checked for mosquitoes. So we're keeping an eye on the stage of development of mosquito larvae so that we can then figure out a way to control them. And that's what the helicopters are used for in the first sense. In the second, the helicopters are also used for control, and that's actually relatively rare. For larviciding, we do that quite often with the helicopter. With adulticiding, we haven't actually done an adulticide or killing adult mosquitoes with the helicopter since 2009.
So it's just something that people think of. They think that they're going to come and spray over my house.
Well, I think the first thing people see is when they see the helicopter, they just automatically assume that we're spraying something. And actually about 90% of the time, we're just out surveying the salt marsh looking for mosquito larvae to see what's happening, where they are in their stages, so that we can direct control.
And with 45 different species, and different marsh and different areas, then your staff is busy throughout the year trying to figure out how to control the different species.
Right. Certainly the summer season is active, more active for us, and we take on seasonal employees to fill that that need. But in the wintertime, we're still doing mosquito control, but we do it in a different way. And in the winter is when we get a lot of water management done, because there's no mosquitoes around, the tourists have pretty much gone, but we can do that ditching and that ditch cleaning throughout the winter, and we do that so that the water flows and we don't have mosquito problems come the next season.
Yeah, I'd like to just point out how impressive the mosquito control department was when I first went there to do the tour, not just with the recent visit with the Department of Agriculture, but did the tour of the facility and learned everything that they did there. I was impressed, very impressed, and I think a lot of other people have been too. They work very hard at what they do. I think people misunderstand what the mosquito control department is all about, and hopefully this gives them a better understanding. But I think one of the most important things for people to know is that they're working hard to do everything they possibly can to make pesticides as a last resort. And I think everyone wants to see a limited amount of pesticides being used, and they're working diligently to see that happen.
And that's a great point, Freeholder. And in our area with sensitive environment, you worked with other groups throughout the county to preserve the environment. We're just about out of time, but you've worked with the Coxhaw Creek Project down in Lower Township. So many different projects to preserve the environment and make it a wonderful place for our residents and our visitors. And if people would like more information about the mosquito department, they can call your department and also come and visit. It's a wonderful facility there to see. Until next time, I'm Lenore Bonifante. See you on the Cape May County Report. For more information, go to capemaycountygov.net.